And speaking of patient education, Dr. Ermann, I'd love for you to share if you can have any ideas around the role that patient education plays in recognizing and managing treatment-related side effects.
Yeah, absolutely. I'm a big advocate on educating patients, and I completely agree with what Dr. Chang mentioned. I think, prevention is the key. I think, the more work you can do up front to improve the outcomes down the road, the better. In my experience, what I do for my patients in the clinic, when it comes to education is I do quite a few things. I not only do I myself personally educate the patient on the drug, I also have my pharmacist meet with the patient, either in person or over the phone, depending on where things are at. I also print out handouts because occasionally we hear a lot of things, and as patients, sometimes it can be overwhelming. Even as doctors, it can be overwhelming hearing a lot of things at once. I like to print things out for my patients, whether it be from up-to-date pages, whether it be from things like the websites that have drug information like HemoCare, et cetera, et cetera. And I also utilize kind of these free sheets that you can find throughout from many different organizations, such as like Lymphoma Research Foundation, or others that have drug information, safety information. And then I also recommend them easy ways to contact us, whether it be through like a messaging app or calling our office with questions. I think that educating your patients on what to expect with these drugs is really important. Fortunately, in CLL, a lot of our medications, though there are some unique toxicities, are overwhelmingly much better tolerated than many other therapies for other cancers. That is one good thing. You want to give them enough information, but you don't want to scare them to thinking that they're going to have the worst of every situation. But I think it's very important, especially upfront, and then most patients kind of will see how different drugs affect them.
Thank you, Dr. Erman. I love that you're offering multiple different ways because, like you said, some people may be auditory learners. Many other patients, when they're hearing this information for the first time, as you alluded to, they're going to be overwhelmed. They're not going to remember. So I love the idea of also leaving them with something in writing that they can refer to later. What about you, Dr. Chang? You've been doing this for a while now. Are there any specific strategies or something that works really well for you, a particular tactic as it relates to educating your patients about side effects?
Yeah, I couldn't agree more with Dr. Erman. I spend quite a bit of time again speaking directly to my patients, having my team speak to my patients, and I follow many of the similar strategies that Dr. Erman has already mentioned. In particular, places like Leukemia Lymphoma Society, Lymphoma Research Foundation, the CLL Society, all those societies have a wealth of information about the different treatments and approaches that we normally use for CLL. And I find it very useful that as part of our discharge paperwork from clinic, we do include links to those societies so that they can find additional information. And aside from that, I think once you have a good rapport with a patient and your team has a good rapport with a patient, um, uh, as long as there's good communication either through the patient portal, through phone calls, through return visits, I find that once patients are very well educated, then they are actually very comfortable starting therapy and pretty much know exactly what to expect at each step in the therapy, whether it is a dose escalation week for venetoclax, for example, or what happens when we have to hold a medication for a procedure, when to restart, and those sorts of things.